Substance withdrawal. Essential features of substance withdrawal. The presence of a clinically significant cluster of symptoms, behaviors, and/or physiological features that occurs upon cessation or reduction in the use of a substance in individuals who have developed dependence on that substance or have used the substance for a prolonged period or in large amounts. The specific features of substance withdrawal depend on the pharmacological properties of the specified substance and are consistent with those recognized as occurring upon cessation or reduction of the particular substance or other members of the same pharmacological group of substances. The symptoms also vary in degree of severity and duration depending on the substance, and the amount and pattern of prior use. The symptoms are not better accounted for by another medical condition or another mental disorder. Specifiers for clinical presentation of substance withdrawal. Classification of substance withdrawal: 1. Substance withdrawal, uncomplicated. 2. Substance withdrawal, with perceptual disturbances. 3. Substance withdrawal, with seizures. 6. C4x.40 Substance withdrawal, uncomplicated. All diagnostic requirements for substance withdrawal are met and the withdrawal state is not accompanied by perceptual disturbances or seizures. 6. C4x.41 Substance withdrawal, with perceptual disturbances. All diagnostic requirements for substance withdrawal are met and the withdrawal state is accompanied by perceptual disturbances, for example, visual or tactile hallucinations or illusions, with intact reality testing. There is no evidence of confusion and other diagnostic requirements for delirium are not met. The withdrawal state is not accompanied by seizures. 6. C4x.42 Substance withdrawal, with seizures. All diagnostic requirements for substance withdrawal are met and the withdrawal state is accompanied by seizures, i.e., generalized tonic-clonic seizures, but not by perceptual disturbances. Additional clinical features for substance withdrawal. Substance withdrawal symptoms become more severe with repeated episodes of withdrawal, termed kindling, with aging, or in the presence of comorbid medical conditions. Common substance-specific features of substance withdrawal. 1. Alcohol withdrawal. Presenting features of alcohol withdrawal may include autonomic hyperactivity, for example, tachycardia, hypertension, perspiration, increased hand tremor, nausea, retching or vomiting, insomnia, anxiety, psychomotor agitation, depressed or dysphoric mood, transient visual, tactile or auditory illusions or hallucinations, and distractibility. Less commonly, alcohol withdrawal is complicated by seizures. Additional features. Onset of alcohol withdrawal typically occurs within 6 to 12 hours after last use, as blood alcohol concentrations decline. Features of mild or moderate withdrawal typically last for 3 to 7 days after cessation of alcohol use and include autonomic hyperactivity, increased hand tremor, anxiety, insomnia, nausea, vomiting, and headache. Features of moderate withdrawal may also include transient visual, tactile or auditory illusions or hallucinations, distractibility and psychomotor agitation. In 1 to 3% of cases, alcohol withdrawal is complicated by seizures of a tonic-clonic type. Approximately 2% of cases of alcohol withdrawal progress to a very severe syndrome, sometimes referred to as delirium tremens, DTs, characterized by confusion and disorientation, delusions, and prolonged visual, tactile or auditory hallucinations. When delirium is present, a separate diagnosis of alcohol-induced delirium should also be assigned. 2. Cannabis withdrawal. Presenting features of cannabis withdrawal may include irritability, anger or aggressive behavior, shakiness, insomnia, restlessness, anxiety, depressed or dysphoric mood, decreased appetite and weight loss, headache, sweating or chills, abdominal cramps and muscle aches. Additional features. Onset of cannabis withdrawal typically occurs at some point between 12 hours and 3 days after cessation or reduction of use. Symptom severity typically peaks at 4 to 7 days and may last for 1 to 3 weeks after cessation of use. 3. Synthetic cannabinoids withdrawal. Presenting features of synthetic cannabinoid withdrawal may include irritability, anger, aggression, shakiness, insomnia, and disturbing dreams, restlessness, anxiety, depressed or dysphoric mood, and appetite disturbance. 4. Opioids withdrawal. Presenting features of opioid withdrawal may include depressed or dysphoric mood, craving for an opioid, anxiety, nausea or vomiting, abdominal cramps, muscle aches, yawning, perspiration, hot and cold flushes, hypersomnia, typically in the initial phase, or insomnia, diarrhea, piloerection, and pupillary dilation. Additional features. Opioid withdrawal occurs in phases. The early phase typically includes lacrimation, rhinorrhea, and yawning. This is followed by hot and cold flashes, muscle aching and abdominal cramps, nausea and vomiting and diarrhea, piloerection and pupillary dilatation may also occur. The later phase is dominated by craving for opioids. 5. Sedatives, hypnotics or anxiolytics. Presenting features of sedative, hypnotic or anxiolytic withdrawal may include anxiety, psychomotor agitation, insomnia, increased hand tremor, nausea or vomiting, and transient visual, tactile or auditory illusions or hallucinations. There may be signs of autonomic hyperactivity, for example, tachycardia, hypertension, perspiration, or postural hypotension. The withdrawal state may be complicated by seizures. Additional features. Sedative, hypnotic or anxiolytic withdrawal may be complicated by seizures, which are of a tonic-clonic type and may be single or multiple. Sedative, hypnotic or anxiolytic withdrawal, especially when untreated, may progress to a very severe form of delirium, characterized by confusion and disorientation, delusions, and more prolonged visual, tactile, or auditory hallucinations. Medical sequelae of complicated withdrawal include status epilepticus, respiratory compromise, and renal failure. Some features of sedative, hypnotic or anxiolytic withdrawal, such as anxiety, transient illusions or hallucinations, and derealization, may persist for several months after cessation of use. 6. Cocaine withdrawal. Presenting features of cocaine withdrawal may include depressed or dysphoric mood, irritability, fatigue, psychomotor agitation or retardation, vivid unpleasant dreams, insomnia or hypersomnia, increased appetite, anxiety, and craving for cocaine. 7. Stimulants including amphetamines, methamphetamine, and methcathinone withdrawal. Presenting features of stimulant withdrawal may include depressed or dysphoric mood, irritability, fatigue, insomnia or, more commonly, hypersomnia, vivid and unpleasant dreams, increased appetite, psychomotor agitation or retardation, and craving for amphetamine and related stimulants. Additional features. Stimulant withdrawal typically occurs within 24 hours to 4 days of cessation of stimulant use and is characterized by a dysphoric and low energy state manifested by depressed or dysphoric mood, irritability, fatigue, inertia and hypersomnia. In the first phase of stimulant withdrawal, which typically lasts for 7 to 14 days, low mood, lethargy and hypersomnia predominate. After this phase, irritability and craving for stimulants are prominent and may persist for 6 to 8 weeks. 8. Synthetic cathinones withdrawal. Presenting features of synthetic cathinone withdrawal may include depressed or dysphoric mood, irritability, fatigue, insomnia or, more commonly, hypersomnia, vivid and unpleasant dreams, increased appetite, psychomotor agitation or retardation, and craving for stimulants, including synthetic cathinones. 9. Caffeine substance-specific features of withdrawal. Presenting features of caffeine withdrawal may include headache, marked fatigue or drowsiness, irritability, depressed or dysphoric mood, nausea or vomiting, and difficulty concentrating. 10. Nicotine withdrawal. Presenting features of nicotine withdrawal may include depressed or dysphoric mood, insomnia, irritability, anger, anxiety, difficulty concentrating, restlessness, bradycardia, increased appetite, and craving for tobacco or other nicotine-containing products. Other physical symptoms may include increased cough and mouth ulceration. 11. Volatile inhalants withdrawal. Presenting features of volatile inhalant withdrawal may include insomnia, anxiety, irritability, depressed or dysphoric mood, shakiness, perspiration, nausea, and transient illusions. Volatile inhalant withdrawal may be accompanied by persisting features of volatile inhalant intoxication or its medical complications such as encephalopathy, especially when the inhalant used is lead containing petrol/gasoline. 12. MDMA or related drugs, including MDA withdrawal. Presenting features of MDMA or related drug withdrawal may include fatigue, lethargy, hypersomnia or insomnia, depressed mood, anxiety, irritability, craving, difficulty in concentrating, and appetite disturbance. Additional features. Thanks for watching. Please like and subscribe.